Morning everyone, I'm back with Neil Grant, Solicitor Extraordinaire. So welcome back, Neil, how are you?
I'm very well, thank you. Thank you, good.
And how's life treating you down south?
Yeah, I'm a southerner. Yeah, well, things are okay. We're sort of going back to the office now, 2 or 3 days a week on a rota, and life seems to be sort of coming back to normal, really, obviously after sort of almost 6 months at home. But yeah, no, all looking good.
Absolutely. Well, I did the school run for the first time today for 6 months.
Lucky
So
you.
that was a big shock, taking my baby into sixth form.
Oh, there we are. Yeah, quite. So things are changing. Yeah.
Yes, life is feeling a bit more normal. So Neil, for those people watching who may have missed our previous interview, could you let everybody know who you are and what you do, and how you can potentially help the audience in the future?
Yeah, no, sure. So, well, yes, I'm a regulatory lawyer for my sins in the health and social care arena, and I've been doing that for quite a number of years now. Let's not sort of dwell on the past. Let's look forward. But over that time, I obviously acted for inspectorates like the CQC and its predecessors, the Healthcare Commission, and these days I only act for providers. So I act for providers across health and social care. So it can be dental providers, GPs, and adult social care providers as well. So very broad. I focus quite a lot on CQC, but also on commissioning issues as well. And increasingly what I'm finding through the pandemic is that because I'm in a full service firm, I'm actually getting people coming in now that actually want to digitalise their services and looking at sort of agreements around that and information governance, and also looking at opportunities really. Because people are sort of finding that there are sort of opportunities to expand their businesses. And we've obviously got a corporate commercial arm as well, so we can look at all of that and look at the employment dimension as well. So I think it's quite exciting really. I mean, I think there's quite a lot going on. And I'm broadening my sort of remit and sort of linking up with other people at Gordon's where I work, so all positively.
Excellent. So Neil, what do you feel is the trend? Because I know you've been doing a lot of research in and around changes within CQC legislation and almost trying to forecast what might happen in 2021. So what's your feel on things for the future?
Yeah, I mean, CQC obviously, it says it's an open and transparent organisation. And I mean, we could debate that one. But they are sort of giving indications about the future. And I think what we can say is that obviously everybody has had to adapt because of the pandemic, and particularly CQC, because we know they stopped inspections in March, routine inspections anyway. And they've been targeted, more risk-based, as we know. So they are increasingly carrying out more inspections of providers, but it's a problem, isn't it? Because we don't know quite where this pandemic is going to go. There are local lockdowns. And I think CQC is now sort of committed to regulating differently in the future. They're not going to go back to what they were doing before, which was really the classic sort of inspection. In the dental sector, obviously, they would take a proportion, wouldn't they, of providers on an annual basis to do that. And what I think they're saying is that really sort of those inspections are really quite a sort of rigid way of operating. And what they want to do is have a more dynamic system of regulation where they're getting more contemporaneous, more live information about services, so that that can go up on their website, and there may be sort of dashboards, I suppose, in the future. So the classic inspection followed by the inspection report, I think is probably something in the past really now. It's historic. They will obviously carry out inspections, but increasingly I'm noticing them doing sort of focused or targeted inspections, not the big inspections, partly because I think they're expensive. They're expensive for CQC and ultimately through the fees for the sector. And obviously it is a burden on the sector. So they are trying, I think, to sort of blend the way in which they operate now. So I think there's going to be desktop regulation. There's going to be that remote element, which obviously they've had to sort of fall back on during the pandemic. And then there'll be these targeted inspections, but they'll be pulling in a lot more data intelligence. So they're saying they want to be a sort of data-driven regulator in the future. Far more modern. I think they're going to be using AI. They'll be using mobile apps in terms of inspections and also enforcement for the future. and there's going to be a digital platform in terms of provider engagement. Obviously, there is sort of that at the moment, but I think they're going to ramp that up. And increasingly, I think they're also very keen to draw on the voice of the user of services. And obviously, they're supposed to be doing that anyway, because the patient, the service user, should be at the centre of everything they do. But I think that they are looking increasingly at how they can capture more and more information from service users, from patients, to make sure that obviously does influence the way in which they regulate, and they can maintain, or they can ensure they're relevant and future-proof for the future. I think those are some sort of headlines, really, from my sort of review of blogs and board meeting minutes. Lucky person that I am, that I have to sort of look at all of this stuff. But yeah, I think it's going to be a transformation. I think it's going to be quite radical.
Yeah.
And they've said that they're going to consult on the changes in the new year, so in January, with the likelihood that those changes will come in from sort of April, May of next year. So obviously we'll sort of be the wiser when we see their consultation document. They've also said that they're moving on from the emergency support framework, which they obviously sort of implemented, didn't they, from May of this year, which is the classic telephone conversation with the provider. And I think that will remain in place as an element. There will be that sort of telephone contact. But I think they're also trying, I think, to expand their remit, because obviously the telephone contact was very much focused on COVID and infection prevention and control in particular. And that will continue to be a major issue, particularly for dental providers, over the course of the next 12 months. But they're looking to sort of extend their sort of remit, I think, in terms of what they're looking at, and having what they call a streamlined set of CLOEs, the key lines of inquiry. Unfortunately, we've not seen anything published from CQC as to what they're exactly doing in relation to this transitional regulatory approach. But yes, I think it's, you know, so it may sort of involve targeted inspections in some limited cases. There may be thematic reviews in some areas. And then they're moving then, I think, over the next 6 to 8 months to this complete new sort of digital way of working, supplemented obviously by sort of targeted inspections. And so I think, you know, I think as a regulatory lawyer that's basically just been used to things being the same for, you know, the last sort of, I was going to say 50 years, I've not been around that long, but quite a long time anyway. It's quite, you know, it's quite interesting, exciting to see that there are going to be these changes to the way in which CQC operates. And hopefully it will lead to more effective regulation. Obviously, that's
exactly. And I think I was quite reassured when I interviewed John Milne, actually, probably a month ago now, that, you know, the regulator is looking to reinvent themselves and it to fit with what dental practices are doing, and actually meet the need more closely as well. Like you say, more of a live contemporaneous approach rather than just historical paperwork or evidence. And you know, it's how we work today, not how we worked yesterday, that's important, isn't it? So yeah, I think it's quite a positive slant that CQC are taking.
Yeah, I think so. And I think they're sort of, I mean, they're quite forward thinking in their own way. I mean, I think they realise as well that not only are these inspections expensive, as you say, and sort of resource heavy as an organisation, but there are sort of issues, I think, sometimes about the quality of inspections and the quality of reporting, and they do get challenges, and I think that sort of blocks up their system, as it were. And I think they need to, become, I think, well, they're saying smarter regulation, that's how they're describing it, isn't it? I think in the future. And obviously we sort of look forward to that. I mean, how we sort of measure that smarter regulation and success, I mean, clearly there's the issue about making sure that it is targeted and effective, and it doesn't put an undue burden on the sector or sectors generally. So I think that's obviously important. Also that it's open and transparent, because one issue for me is, I mean, obviously it's important that the public get the information they would like to see from the CQC website, not a long, lengthy report that they're not really going to sort of drill into or necessarily fully comprehend. So you want a lighter digital set of information, data, so that the public can use. But at the same time, I think it's also important that CQC will actually provide information to dental practices, so that it's not just headlines. You've actually got sort of details which will actually sort of assist those providers in terms of improvement, which actually brings me on to another debate, because CQC is suggesting that they could actually develop an improvement arm. They could become an improvement agency, which is unusual because, I mean, so far they've really been sort of command and control, and it's all about investigation and compliance and taking enforcement. And there's a token reference to improvement sometimes, you know, through perhaps setting recommendations, I suppose, in reports. But they're now saying, well, actually, we like this supportive role that we've had through the pandemic, and we intend to continue with that. So it's going to be an interesting sort of juxtaposition, really, of improvement and enforcement. Probably, you know, maybe looking forward, maybe they could become a bit like the health and safety executive, where they become more specialised in terms of their enforcement arm, and more credible, I think, really, as an enforcer. But at the same time, they'll be issuing guidance, more guidance to the sector. Maybe they'll be putting on workshops, training as well, and possibly even sending out sort of inspectors to services to support those services, as it were, more directly, or sort of linking up with stakeholders to ensure that does happen in an effective way. Because a lot of people talk about support, don't they, and improvement, but sometimes it doesn't feel that way.
No.
In the system at all. And so hopefully they'll be sort of true to their mantra, that they are there to sort of support providers, and it isn't just about you know, regulatory actions.
Absolutely, and I very much hope that that is the, you know, the approach that they take. I think dentistry feels very much forgotten, you know, pushed to the back of the room across COVID. And yeah, we've had the emergency support framework, but yeah, I think we do need that handhold in the future. I think we all, you know, dentistry always feels persecuted in some way. So to have some support, I mean, how good would that be? It'd be so refreshing, wouldn't it?
It would, yeah. I mean, yeah, a sort of pragmatic approach, a sort of sensible approach, a common sense approach, where they look at the context, they look at the challenges, the difficulties. They have that supportive role. I mean, clearly, obviously, ultimately, if that support doesn't lead to sustained improvement, if it's needed, then obviously there has to be reference to those sort of enforcement levers that they've got, I suppose, in a minority of cases. But yeah, so I know, I think there's a lot that's going to be happening over the next 6 to 8 months, I think, in terms of regulation. I'll obviously be trying to sort of monitor what's going on. I'm asking them via freedom of information to provide me with information. Sometimes they even provide it to me. Sometimes they don't. We'll have to see what will happen. But I'll keep in touch, Nicki, and whatever I find out. Yeah,
that would be fantastic. One final question: within the emergency support framework, have you seen any key issues being flagged up, you know, since May?
Well, I mean, obviously, the issues around infection prevention control, that's the sort of focus, isn't it?
It is.
And I suppose in the context of dental providers, it's crucial, isn't it, really? The whole sort of decontamination regime that they're supposed to sort of follow. I've had a case recently where a provider, not a dental provider, but a healthcare provider was subject to an inspection targeted that led to a suspension of their service.
Wow.
And because of concerns around infection prevention and control. So clearly that's a big issue for them. Fortunately, we were able to sort of negotiate and manage that process. CQC came back after a month and they re-rated the service from inadequate to good, and they lifted the condition which was preventing the operation of that healthcare provider. So they lifted it there. So, but yeah, I think the focus is very much going to be around safety and leadership. Those are the main areas. It's giving that assurance to the provider that you are on top of it.
Absolutely.
And you know, obviously that's what you're all about, isn't it? With your service.
It is, absolutely it is.
With your service, your consultancy. So well done for you. So
It is.
great. Okay. Well, no, thank you. I hope you found that useful.
Yeah, no, absolutely, Neil. Thank you so much. And it'd be great if, you know, again, if we can just keep reconvening, you know, every other month possibly, and just actually just revisiting where things are at, any progression within what's happening behind closed doors at the moment, you know, and just share what we found out and feed it to our audience. That would be absolutely brilliant.
Okay, no, thanks for your time and the opportunity to sort of present today. So all the very best.
Thanks for your time.
Okay, take care.
Okay, thanks, Neil.
Bye.
Bye
Stay
for
safe.
now.
Bye.
Bye.
Bye.